common things that you're seeing upper quadrant wise, and then what can you relate it to, and then how can you help them out?
Yes. I think especially, and we always bring it back to the events of last year, which created, for at least a period of time, less movement generally, right? And being more at your desk, a lot of things transitioning to Zoom. A lot of people were getting stuck in a more flexed thoracic position, and then it was bringing the shoulders into a more dysfunctional position. And so now we're coming out of that. It's getting better, but we definitely have we have a little bit of a trend with people who have mentioned for the first time, like an episode of carpal tunnel or wrist pain or like forearm into the elbow pain. And it's sort of, appearing out of nowhere. It can certainly be related to the shoulder position. And actually, not only can it be related to the shoulder of the corresponding arm, it can be related to the shoulder position on the opposite side.
That's a great point. We see that all the time.
Yeah. And we see it all the time. And the funny thing is, you would think after, how long have we been doing this? I don't know about you, but sometimes I get surprised. Like, I'll be like, look, we actually had to change the position of the left shoulder, and now your right wrist feels better. And if you're listening right now, you might be like, what? But the way I like to liken it, just to at least lay the groundwork for this, and then Matt, I know you are very good at your like technical deep dive, so I'll lay the groundwork. You can get a little more academic with it, and then we'll zoom back out maybe.
We'll see if it makes sense.
We'll see if it works.
See if it come out on the other side.
Yeah. So essentially, the reason I was saying, let's say you're right-handed. We do want to look at what the right shoulder is doing, absolutely. But it's important to recognize that if you think of a seesaw and a kid sits on one end of the seesaw, yes, that end of the seesaw is going to go down, but the other end is going to go up. So you can't just affect change on one side without the other side having to respond. And if you think of your shoulders and your hips the same way, maybe we're like, oh, look, the right shoulder is depressed, right? But even still, if you're getting the shoulders to level out, that means the left one has to come down, the right one has to come up. And we're just talking in one plane of motion to illustrate the point. We're just talking about one plane of motion. But that is one way that you can affect change on one side when the dysfunction is on the other.
Right.
And then the other planes of motion that tend to really trickle into golfer's elbow, tennis elbow, and then carpal tunnel. I like to call it, I don't even know if this is the thing, but just like we have tibial torsion in our legs where your femur rotates in one direction and your tib rotates in the opposite, and then maybe your knee bothers you or something like that. If you think of your arm like your upper femur and your elbow like your knee, kind of the same idea here. You 100%. Can have a little bit of humeral ulna torsion as a result.
You heard it here first.
Yeah, you heard it here. TM.
Yeah.
If your shoulders protract, like, how I was talking about your upper thoracic being a little bit flexed or rounded, about a minute ago. When that happens, the shoulder is going to be a little more protracted. You'll notice then this arm starts to rotate here. And then you're operating, you might not even realize it, but if you're typing with this carrying angle, then it's forcing a lot of torque at the elbow. And then you're trying to, flex and extend your fingers and your wrist with all this torque that traces down the arm.
Yeah.
And so that's just to illustrate the point of how much the joint or two joints above your wrist the position of that joint totally matters. So yes.
Yeah. I think it's great because it's one of the biggest things that we'll see in the clinic that can affect like elbow pain or ulnar nerve compression if people have like nerve pain in their fingers, which is stemming from their elbow, or like you said, tennis elbow, golfer's elbow, even arthritis in the fingers. We'll see a lot with like thumbs. People have arthritis in their thumbs and can't open jars or doorknobs or turn the key to get in a house or car, things like that.
Yeah.
You can oftentimes trace it back to the shoulder. And like you said, that inward rotation of the shoulder itself. I think you said it perfectly, like typing, right? Like typing or driving or writing or like all the activities we have that we do in our modern world cause us to be this position with our hand, so-called rotated forearm position, and then internally rotated in your shoulder.
Yeah. And think about how that happens in the lower body. Like if your ankle is pronating in, like that is uncomfortable, that causes strain in the ankle and the knee. Just think about this like your upper foot.
Yeah.
Same idea.
Yeah. Yeah. It's your shoulder leg, your
my shoulder leg and my upper feet.
Otherwise, arm. Yeah, that's right. Yeah, shoulder leg.
But I do say that because I think it's easier to translate that idea when we talk about our lower body, because we're walking, we're feeling our feet all the time. So if we all know that supinating, like if you roll to the outer edges of your foot or pronate, how uncomfortable that is. Same deal with your hands.
Yeah, 100%. It's pretty amazing, the network of muscles in the forearm, hand, and then upper arm too. So biceps, triceps, deltoid. And you have all of these muscles that create all of these different motions, like this, we can do all these things. When you lock the hands and arms, like you're saying, and elbows in that position for hours at a time, essentially these muscles are getting the work, but then the other ones aren't. And that's where, like you're saying, a lot like the nerve compression, the tennis elbow, golf elbow, arthritis, carpal tunnel, that's all due to muscle imbalances that's now starting to press on the nerve, starting to deviate bones out of alignment, which can lead to some rubbing, which is arthritis. And even so, the topics that we had in Boston that people requested are rotator cuff tears and bursitis. So rotator cuff being a major muscle group that helps to externally or outwardly rotate the arm. So outward or external rotation is what the rotator cuff does. But like we were saying, driving, typing is putting us here. So that, and actually what leads to a lot of those inflammatory conditions or carpal tunnel or something as simple as Raynaud's. I'm not sure if you guys get a lot of that out in sunny California, but where people's hands get really cold or they can turn white due to lack of circulation. Get that on the East Coast during the winters here, called Raynaud's. But what all that's traced back to is the arteries, veins, and lymph vessels that help bring blood flow to the arm, air blood flow out, the nerves even that go into your arm that control your elbow, arm, hand, travel through your collarbone, and then go through like the front of your shoulder. So if the shoulders are tight, like you said, and rounded like this,
you're restricting that.
Or occlude that whole canal that those and blood flow is going to be limited in that area. If people notice a lot of things, we have a lot of clients who are avid bike riders who notice their hands go numb when they're when they're sleeping. Things like that. It's the same kind of thing. Biking, you're here, sleeping, you're here, and you're just feeding into that forward position, which is just cutting off the blood flow down into the hand, creating that falling asleep feeling. If there's constant swelling, like arthritis, the body's not able to clear out inflammation, and inflammation is a natural byproduct. Whenever we type like this, inflammation is happening, but our bodies are designed to clear it out so it doesn't cause an issue. If it becomes chronic, it's because the shoulder's tight, so the lymph can't go in through the arm, clear out the swelling, and then travel back up into the center of the body. It's amazing just how many functions and systems are affected by a rounded forward shoulder position.
No kidding.